Okay, so good afternoon, everyone. Thank you for joining us today as we have an exciting presentation about eating well for a healthy immune system. Where we will learn more about how we can protect ourselves against COVID-19. My name is Veronica, and I am a registered dietitian. I'm co-presenting today with my registered dietitian colleagues, Fatim and Samantha, who work with me in the cardiac rehab program at the University Health Network. Fatim works at the Toronto Rehab location with myself, and Samantha works at our partner program located at Toronto Western Hospital. The objectives of today's presentation are to speak to the myths and facts about foods and supplements that protect against COVID-19. We will discuss how to support our immune system with food, and we will share some great tips on safe grocery shopping and cooking during this challenging time. Please keep in mind that the information we are sharing with you is current knowledge as of today, which can change in the future as research develops. So ground rules. It is always important to establish some ground rules, and if you've watched Dr. O's previous webinars this week, you will be aware of them. If not, I will review them now. So this session is for education only. We encourage you to connect with your own healthcare provider for specific advice about your situation. When you do submit a question, we will answer questions generally. If you would like a more specific question for your situation, we would ask you to please follow up with a healthcare provider. And the presentation today should last around 30 minutes, leaving 15 minutes to answer your questions at the end. We will answer these questions generally. So again, if you need more specific answers, please connect with your healthcare provider. And if we don't have enough time to answer all your questions today, we encourage you to link back to our website, cardiaccollege.ca, and we will have all the answers to the submitted questions posted there within 48 hours. Now we are using Zoom to conduct this meeting, and to orient you, if you hover your mouse over the lower part of the screen, you will see a box that says Q&A. This is where we will ask you to write in your questions for us, and once you have clicked on the Q&A icon, this box should appear, the one that's in the screen now, and you will have the opportunity to type your question here, and you can type it throughout the session today. Okay, so now I will pass on the presentation to Fatim to start our session.
Thanks so much, Veronica, and hello everyone. So I'm sure that in addition to all the self-isolation and hand-washing information that we've been bombarded with over the last few weeks, many of us have also been hearing a lot about nutrition information and preventing COVID-19. Social media has been full of advice on immune-boosting foods. Some of this information can be confusing and even add more stress to our life. I know in my WhatsApp groups, I'm forwarded eating tips to prevent COVID-19 at least a few times a day. Everything from drinking warm lemon water, to eating mushrooms and garlic, to taking ginseng, eating a keto diet, or only eating alkaline foods. This morning, I was even shown a recipe for something called bulletproof coffee that apparently helps your immune system. There are also a lot of supplement companies promoting super immune boosting pills. So how do we know what's real and what's fake? It's often hard to know what to believe. So are there any foods or supplements we should be eating daily? Well, the simple answer is no. There are, unfortunately, currently no specific foods, supplements, or natural health products that will prevent you from catching COVID-19. This is the statement that Dietitians of Canada published last week, outlining this, and you can read more about it on their website. If we look at our immune system, it's quite complex, and many different nutrients are involved in its proper functioning. Unfortunately, we can't turn it on and off by using a supplement. We need adequate protein, as well as many different vitamins and minerals on a daily basis. Veronica will be speaking on how to ensure that you get the right balance of nutrients in your diet, and Sam will take us through some tips on grocery shopping and cooking. For now, I'll go over some specific nutrients that have been linked to immunity. Some research shows that vitamin C, vitamin D, zinc, and selenium may make the immune system stronger. However, for most people, there's no good evidence that taking more of these nutrients in supplement form will improve your immune system beyond what you're getting from a healthy diet. Let's take a look at these. And if we start with vitamin C, there has been some research that has shown that regular vitamin C intake may be able to reduce the severity of or the duration of cold symptoms. However, vitamin C does not prevent you from catching a cold or a virus. Vitamin C is a pretty easy vitamin to get in our diet. It's found in many fruits and vegetables. Examples include citrus fruits, peppers, kiwi, broccoli, and berries. So incorporate these foods into your diet. Try things like broccoli in a soup or peppers in a stir fry. Maybe add some berries to your cereal or on top of your yogurt. I know these days a lot of us may not be going out to grocery shop as often as we're used to, and our fridge might not be full of fresh produce. So that's where frozen fruits and vegetables are an excellent substitute for fresh. They're easy and they contain just as many vitamins and nutrients. Vitamin D, or our sunshine vitamin, has also been shown to have a role in regulating our immune system. Again, we may not be getting enough sun these days when we're in self-isolation. And Veronica will speak to the recommendations around getting vitamin D in your foods and from supplements. If we move on to zinc, zinc is a mineral that's also important for a healthy immune system. And like vitamin C, some research has shown that zinc may help reduce the duration of cold symptoms. However, for most people, the immune system can be maintained just by getting your daily recommended intake of zinc from foods. So you can find zinc in foods such as lean meats, poultry, and fish, in seafood, legumes, nuts, and seeds. You'll notice all of these foods are foods that we've been promoting as part of the Mediterranean way of eating. So, enjoy things like fish and poultry on a regular basis, include those legumes, maybe add beans or lentils to a soup, snack on a handful of nuts, or maybe even spread some peanut butter or almond butter on a piece of toast. Just coming back to zinc supplements, it's important to note that many of the zinc lozenges that you can buy in the pharmacy exceed what we call the upper limit for intake, so they're beyond the safe level for daily intake. So you should always consult with your doctor before you take any of these, and these should only be for very short-term use. Selenium is an antioxidant that works with vitamin E to keep us healthy. Again, no research to show the benefits of taking it as a supplement, but your focus should be including selenium-rich foods on a regular basis. These include things like seafood, whole grains, especially whole grains that include the germ or the inner part of the grain, as well as nuts, and Brazil nuts especially are a good source of selenium. So that brings us to other natural health products and foods such as herbs and spices. So it's important to remember that when you're looking at natural health products such as herb extracts or supplements, the term natural doesn't necessarily mean safe. There's still a risk of side effects, of allergic reactions, or even medication interactions. So you need to be really careful with these. A couple of the ones I've been asked about recently are echinacea and oregano oil. So if we look at echinacea, it's traditionally been used to help ease sore throats, but there's no evidence that it protects you from getting COVID-19. With oregano oil, there's very limited research on how effective it is, what the dosing should be, and potential side effects. We do know that it can interact with certain blood thinner medications, so you want to be careful with that. And then what about things like herbs and spices, garlic and turmeric? Well, currently, there's no research to show that these can protect against viruses such as COVID-19, but we do know that they're full of antioxidant and anti-inflammatory compounds. So go ahead and use them in your cooking. We've always promoted the use of herbs and spices instead of salt to flavor our foods. We also know the Mediterranean diet promotes the use of onions and garlic on a regular basis. So go ahead, spice up your foods. They'll taste better, and you might boost your immune system along the way. Okay, so I'm going to pass it back to Veronica now.
Great, thanks, Fatim. So let's talk about how we can support our immune system with food. As a registered dietitian, we want to emphasize that healthy eating can keep you as healthy as possible. One of the most proactive ways to keep yourself healthy is to consider what you are putting into your body right now. Ultra-processed, prepackaged options are low in fiber, high in sodium and sugar, and don't necessarily give our body all the vitamins and minerals it needs to stay in a beneficial state. Whereas nutrient-rich whole food will support our immune system. Now, does anyone recognize this picture? It's actually Canada's new food guide, which came out over a year ago, but this document has a similar message. It also recommends eating whole foods and limiting processed foods as much as possible. Instead of using food groups and portion sizes, it suggests that we should aim for a quarter of our plate at lunch and dinner time to be protein, the other quarter as whole grains, and the remaining half of our plate to be vegetables and fruits in order to ensure adequate nourishment throughout the day. I personally find this picture an easy visual guideline to follow. What else can we do? We can make sure we're eating enough vegetables and fruit. Our intake of vegetables and fruit should be as high as possible and as colorful as possible right now. The different colors provide us with a range of vitamins, minerals, and antioxidants that only make our immune system stronger. Fresh, frozen, or canned vegetables and fruits are all healthy options. They take little time to prepare, and the canned and frozen options take little time to prepare, and they're convenient, and they're also as nutritious as fresh. But just remember, when you're choosing these canned or frozen vegetables, choose the ones without added sugars, added seasonings, or rich sauces. Now, if you can think back to your lunch and dinner yesterday, was half of your plate vegetables and fruit? If yes, that's absolutely amazing. And if not, how can you change that for today's lunch and dinner? Now, we know that vitamin D helps absorb calcium and is crucial for our health of our bones and our teeth. But as Fatim mentioned, it's also important to support a strong immune system. So in order to get enough of this vitamin, we do need a daily supplement because we cannot get enough in whole foods. There are a few foods that have vitamin D. They include salmon, tuna, milk, mushrooms, as well as egg yolks. But you need to eat a lot of these foods every day to meet your vitamin D needs, which is unrealistic. And we know sunlight also provides vitamin D, but our sun isn't strong enough year-round, and we also recommend wearing sunscreen or sun protection when our sun is strong enough, which would ultimately inhibit the vitamin D absorption from the sun. So another reason why a daily vitamin D supplement is recommended. So how much vitamin D do we need? Adults 70 or older need around 800 international units every day, and adults younger than 70 need 600 international units each day. Now, Health Canada recommends, if you're over 50 years old, to take a daily vitamin D supplement of 400 international units, in addition to eating foods that contain vitamin D. Most vitamin D supplements sold in stores are around 1,000 international units, which more than meets our recommended intake. The next important tip that we can do is to stay hydrated. Fluids help us move nutrients and waste through our body. We also know that the coronavirus acts like a flu with symptoms that could include fever and sweating, which can deplete our fluid status. So if we can maintain a proper hydration status, that will hopefully help us keep ourselves out of the hospital because of dehydration. So some of the signs of dehydration are thirst, dry lips, headaches, dizziness, and dark urine. So it is important to drink fluid often, but even before you feel thirsty, to prevent dehydration. Now, Canada's Food Guide recommends choosing water as your drink of choice to limit added sugar and salt. And you can always try adding a slice of lemon or lime or even a sprig of mint for a little added flavor. Another thing we can do to possibly reduce anxiety, stress, and increase social connection during this time is mindfully eat. Mindful eating is a skill that will help us be present with our food and increase our enjoyment of our meals. We can practice mindful eating by eating more slowly and chewing our food well. This will be easier if we do it distraction-free, which means shutting off the television and putting our phones away, which I know is easier said than done. Perhaps we can also use this time to practice gratitude by thinking about where our food has come from and how many people are working during this time to help bring food to our tables. This includes the farmers, it includes individuals who transport our food, but also the grocery store employees. In the past week, I have heard from many of my patients that one of the biggest challenges about staying home is that they are mindlessly eating. Having unlimited access to food in our home is something that many people are not used to, and it is easy to eat when we are stressed, when we're bored, or just because the fridge is around the corner. If this sounds like you right now, it is even more important to take this time to practice the skill. And if you haven't heard of mindful eating, perhaps now is a perfect time to learn more about it. We have a short 5-minute video on our website, cardiaccollege.ca, that you can watch to get started. So let's take advantage of being stuck inside to be present with our food and enjoy our meals, increase social connection, and possibly decrease our anxiety. Now, if you want to check out our mindful eating video, you can visit our website, cardiaccollege.ca. This is our homepage. And you can click in the top right corner. Here it says Thrive 12-Week Challenge. If you click there, it will bring you to this screen, which includes 12 short videos, all part of the Thrive program. And I do encourage you to look at all of the videos here, but the one I am specifically talking about is the one titled Develop a Healthy Relationship with Food. Now, Samantha will be talking more about how purchasing foods from our grocery stores are safe right now during the outbreak. But if you want to minimize trips to the store, you can buy a little extra of healthy staples that have a longer shelf life. This includes dried or canned legumes like black beans, chickpeas, lentils, nuts and seeds. It includes frozen or canned fish, frozen or canned fruits and vegetables, and whole grains like oats, brown rice, and whole grain pasta. Now, when you're purchasing canned foods, you can look for health claims on the label that say no salt added, low sodium, unsweetened, or no sugar added for the healthiest options. And if you want to learn more about how to choose the healthier options when grocery shopping, you can hop over to our website again, and you can hit the Eating Well section, or Eat Healthy section, of our website. It will bring you to this screen here. And then I invite you to click the Making Healthy Food Choices, which will give you this page that's displayed, and it will have 19 short videos that will take you through what to look for on food labels of specific food products. For example, the one highlighted is about choosing a healthy cereal, and it's a short video, 2 or 3 minutes long, and it talks to you about what to look for on the food label to help make the best choice. So now I'm going to pass this over to Samantha to discuss what else we can do.
Thanks, Veronica. Good afternoon, everyone. I'll be speaking about some tips on how to prepare and purchase food safely during this challenging time. So one of the most important tips that I'll be sharing today is meal planning. And this is important because it can really help you minimize the number of times you go grocery shopping. And you can start with just planning meals around items you already have available in your house. So you can start with your fridge because that's likely where you will have more of the perishable items, and then go to your freezer and the rest of your house, and plan your meals around what you already have. keep note or make a grocery list of any of those items that you're missing. And a nice tip that you can consider is actually arranging your grocery list by where those foods are found in the grocery store. So put all of your produce, like your fresh fruits and veggies, together in one part of your grocery list. Maybe all of your baked goods, like all of your breads, in another part. And this will help you cut down on the amount of time that you spend actually physically grocery shopping in the store. You can also look online to read food labels rather than when you go into the actual grocery store, picking up physically the items and reading the labels in the grocery store. This will once again cut down on some time that you're spending in the grocery store. And if you are interested in learning more about food label reading, we'll have some future talks available online for you to check out on cardiaccollege.ca. Another important tip would be to avoid stockpiling food. And what stockpiling is actually having a large amount of food, and that would be a lot of food that would last you maybe months. There are no nationwide food shortages right now, although food may be temporarily out of stock in your grocery stores because people might be stockpiling on some of these items. Okay, 1 second, trying to go back. Oh no. So we skipped a slide there, but if you do go back, there are a good list of foods that freeze really well. So things like leftovers, so liquids with moisture, so things like soups, stews, and chilies. And as well as things like breads, bags of milk, you can actually freeze really well. So if you go into the grocery store and purchase some fresh products, you can freeze them yourself. If you batch cook a larger amount of food, that will allow you to have some food stocked up for the future in case you do fall ill yourself and you want to have something healthy that you've already made in the past that you can just pull from your freezer. And if you are freezing fresh vegetables, you can actually go ahead and blanch them before you freeze them. So that would be just boiling your vegetables for a short period of time and then putting them into the freezer after you've cooled them properly. So that will be all listed on the slides. A big question that has been commonly coming up is, can you catch COVID-19 from food? And the research is constantly changing as more studies are being done, but the current research shows that there's no evidence that COVID-19 spreads through food. Okay, so in terms of the risk to catch COVID-19 from touching food packaging that's been exposed to coronavirus, that's also been deemed low risk. That being said, there are studies that show COVID-19 can last for hours up to days on different surfaces, and it appears that the virus lives for a shorter time on certain porous surfaces like food, but overall the risk has been deemed low when it comes to catching COVID-19 from food or food packaging. But there are still steps that you can take to minimize your risk, which I'll get into more details in the next few slides. The best way to minimize your risk of catching COVID-19 from these surfaces is by washing your hands really well after touching food packaging and before eating. When you're in the grocery store, you really want to try and limit how much time you spend in there. And so a grocery list is going to be very helpful to help you get in and out of the grocery store quickly. Try and make a list so that you only go once per week or less and avoid running out for only 1 or 2 items. Instead, try using substitutes until you go on your next grocery trip. And of course, avoid shopping during busy times like weekends. If you can, go early in the morning or late at night. And when you are in the grocery store, try physically distancing yourself from other people. So that still applies. At least 6 feet away when you're in a lineup, or avoid a crowded aisle, take a different route, maybe go back to that aisle later on. If you have sanitizing wipes or hand sanitizer at home with you, you can bring those into the grocery store to actually sanitize the cart handles. A lot of grocery stores are actually really great and already doing this, but the most important thing that we should all be doing is washing our hands really well when we get home after we finish grocery shopping. You can also consider avoiding using cash during this time. You can use touchless payment methods like tapping your credit card or tapping your mobile phone. Of course, try and avoid physically tapping your phone to the card reader, but those can help minimize that contact you have with the cashier. And then also think about bringing your own reusable bags and bagging your own groceries to, once again, try and minimize that contact. Some extra tips for safe food handling. So once again, the risk of catching COVID-19 from food packaging or food itself has been deemed relatively low, although research is still emerging. If you want to take some extra precautions to minimize your risk, you can think about washing down your food packages with some dish soap or diluted bleach or 60% alcohol solution or disinfectant wipes before you put them away into your pantry or your fridge. You can wash produce like fruits or veggies that are fresh that you won't be cooking with a small amount of soap and water. And then make sure that you are washing your hands really well with soap and water before you prepare food and after you handle food packaging. This is probably the most important step. All the other factors that you normally would be doing when it comes to safe food handling, like cooking your food to safe internal temperature and keeping cold foods refrigerated or in the freezer, are all still very important. So make sure you continue to do those as well. So once again, the current research does show that the transmission of COVID-19 through food packaging and restaurant foods is low risk, but you can take some extra steps to further minimize your risk, especially when it comes to coming in contact with delivery staff. You can ask for food to be dropped off at the doorstep, for example, and maybe pay online. These things like grocery delivery and restaurant takeout can be very convenient and helpful ways to get groceries or food if you are sick and quarantined and you can't leave your home, if you've returned home from travel in the last 14 days, or if you simply want to minimize how often you're going out of your house. So these can be very convenient and safe ways to get food. And we've listed some resources of grocery delivery services at the end of these slides. Another step you can take when you do get restaurant takeout items delivered to you is to take the food out of the packaging and put it onto a clean container rather than eating out of the takeout container. So using clean tongs and making sure to wash your hands really well after touching any of the food packaging. When it comes to the temperature that COVID-19 is killed off at, there's still research going on around that to determine the exact temperature that kills the virus, but in general, it's recommended to heat your food to at least 149 degrees Fahrenheit or 65 degrees Celsius for at least 3 minutes. So right now, maybe trying to avoid items like raw salad bar items that you can't heat in the meantime, and then in the future, you can return to those items, but for now, just sticking to the items that you can heat up to a safe temperature. So what else can you do? The most important things that you can do to protect yourself from COVID-19 is to wash your hands often and practice social or physical distancing. Of course, we spoke about today eating whole foods and how certain foods could help support your immune system. Of course, getting exercise, enough sleep, and minimizing stress are all very important ways to keep your immune system supported through this time. And of course, taking care of your heart health. So this is a list of resources we put together for you to access some recipes. We have the Cardiac College website, which has various recipes listed. As you can see here, we have grocery delivery services. There's also a service that will deliver groceries and medication for seniors living in low-income housing, and that's run through UHN. As Veronica had mentioned, we have a mindful eating video that's available on the website, and you can view that on this link right here. And if you're interested on staying up to date on the current research for food safety during COVID-19, you can check out the inspection agency website that is listed, some income support programs during COVID-19, and some resources from Dietitians of Canada. So we have an audience poll question now, and I'll go ahead and launch that. Okay, so I'll go ahead and end the poll. So we have majority of people were very satisfied or satisfied with the session, and it seems like the amount of information that we shared was just right. So thank you so much for that feedback. And most people would recommend the session to others. So we have a variety of questions here. So one of the ones that was asked was, dark chocolate good or bad for the heart? And I'm wondering if maybe Fatim could answer that.
Sure. So dark chocolate's great, one of my favorites as well. We do know that the cocoa part of the dark chocolate is full of phytonutrients and antioxidants, so that's the good part. However, when you do buy a dark chocolate bar, there's also added sugar, and there's quite a lot of saturated fat, which we know might not be the best for your heart. So I think the answer would be a small amount in moderation is a good thing. You do want to pay attention to the sugar and the fat content. If you're looking to just get the benefit of the actual cocoa, maybe that's something you can think about, you know, using cocoa powder to make a hot chocolate, or using some cocoa in your baking, and that way you get all the antioxidants, but you're not getting the added sugar or fat.
Great, thanks so much, Fatim. Of course, keep your questions coming. We'll answer any questions that we don't get through today on our website within the next 48 hours or so. So we have another question here. It's a really good one as well. Thank you for the information. However, I believe these are mostly general information from normal days. In this time of coronavirus, and for those of us in self-isolation, how can we have access to daily fresh fruit and vegetables? I guess with more tougher time ahead, we would need to stay more inside and avoid going out for grocery shopping. And this question will be more relevant. What is the alternative to fresh food and vegetables? And maybe Veronica, could you take that one?
Sure. Thank you for the question. Yes, we are going back to basics here with the recommendations about how we can support our immune system, but we do know that these are the recommendations that have the best evidence to support our immune system, and that's why we're sharing them today. We also know that a lot of Canadians aren't meeting these recommendations, so another reason to try to make sure that we are doing our best to meet them. Hopefully Sam offered some suggestions about how you can get food into your house without going outside with those delivery options or the delivery services. But what are some alternatives to fresh food and vegetables? And that would be canned or frozen. So we know canned and frozen can be just as nutritious as fresh, especially for our fruits and vegetables. A lot of the time, these are flash frozen right when they're picked, so they don't actually lose a lot of their nutrients when they're being transported to the grocery stores. So that's why they could be even more nutritious for us. As Sam mentioned too, we can freeze some of the food that we are buying now so that we have it for later days. So I hope that helps.
Great, thanks, Veronica. So, and I'll take the opportunity to answer one comment that was made in our chat. So if you do have any questions, keep them coming in the Q&A section. We'll try and get through whatever we can. But one of the the points that was mentioned was that reusable grocery bags might not be accepted in certain grocery stores, which is absolutely true. I've heard that as well. So in that case, I mean, of course, you'll just go with either maybe the plastic bags that they will be bagging your own groceries in. Some places will allow you to bring your own reusable bags in as long as you are bagging it yourself, just because they're trying to minimize the risk for their own cashiers and their own staff there. So that's a really great point. So I think we have some more questions. I'll just take a second and look through.
Sam, I can answer one of them. So there's
Sure,
a question that says, what type of resource can we use to debunk the credibility of any further food and medicine that protect against COVID-19 from a constant social media or news update? And the example was ibuprofen increasing symptoms. So excellent question. It really can get confusing to know what to believe in. So I think the resources that we've mentioned in terms of food, there's the Dietitians of Canada website, and there's also a website called unlockfood.ca. And both of those have a COVID-19 frequently asked questions section, and they base their answers on the latest current research and let you know what's true and what's a bit misleading. In terms of medications, I know Dr. O did a great presentation yesterday. If you haven't had a chance to look at that, it will be up on the website soon, and maybe you can take a look and listen to that one.
Great, thanks, Fatim. So I'm just going through some more of these questions. I think we might have time for maybe one or two more. And I think there's I'll take the time to answer one point that was, or one question that was made. So thank you for the tip on how to disinfect packed grocery and fresh produce to make sure there are no virus transmissions. But what about fresh herbs like spinach, lettuce, and salad mix? And that's actually also a really great question. So what I would recommend is, if you can, wash items, foods, maybe either fresh spinach or the herbs with a little bit of soap, dish soap and water. The actual produce itself can be washed with those, with a diluted solution of some soap, dish soap and water. And that actually has been said to be more effective than using any of those commercially available vinegar rinses, because that seems to help kind of remove the virus better. You can also think about just buying the ones that are already pre-packaged just for the time being, just so that there is that plastic packaging protecting the food from getting potentially contaminated. So a few options: you either wash the fresh items, the fresh produce, with some dish soap and water, or you can buy the ones that are pre-packaged in plastic. So great question as well. Okay, so I think that is the end of our session. We want to thank you all so much for joining us today. And of course, we'll be running these sessions Monday through Thursday from 1 to 2 p.m. on a variety of different topics. And we'll be back here again next week, Wednesday, talking about another nutrition topic. So make sure to check out the cardiaccollege.ca website for more topics for the future. And thank you all so much for joining us.